your blood group type explained. Every 2 seconds, somewhere in the world, someone needs a blood transfusion. But what many people don't realize is that not all blood is the same. Your blood type is more than just a letter. It can determine who you can save, what diseases you're more resistant to, and even how your ancestors survived thousands of years ago. Today, we're diving deep into the fascinating world of blood groups, where your DNA meets history, medicine, and human survival. Section 1. The ABO Blood Group System. The basics. What makes blood types different? Human blood is categorized mainly by the ABO system and the Rh factor. The ABO system is based on antigens, tiny protein markers, on the surface of your red blood cells. The Rh factor determines whether you're positive or negative. This gives us 8 major blood types: O positive, O negative, A positive, A negative, B positive, B negative, AB positive, and AB negative. The presence or absence of these antigens controls who can receive your blood and whose blood you can receive, because your immune system is trained to attack anything it doesn't recognize. O positive, the world's most common lifeline. O rhesus D positive is the single most common blood type on Earth, carried by roughly 40% of all humans. What makes O positive so important is its reach. O positive blood can be transfused into any Rh positive patient, whether they are A+, B+, AB+, or O+. In emergency rooms, trauma centers, and during childbirth, O positive donors are often the first called. Their blood keeps hospitals running, but O positive tells a story that goes far deeper than medicine. From an evolutionary perspective, type O helped ancient humans survive malaria. In regions where malaria was deadly, O carriers were less likely to experience severe blood cell clumping caused by Plasmodium falciparum. This gave O types a survival advantage, and is one reason O is so common today. However, this advantage came with a trade-off. The exposed H antigen on O blood cells makes O individuals more susceptible to severe cholera and norovirus infections. They also tend to have lower levels of clotting factors like von Willebrand factor, reducing clot risk, but increasing bleeding tendency. O positive is a story of survival, sacrifice, and global dominance. The second type of blood group is A positive. The farmer's blood type. A rhesus D positive is the second most common blood group, present in about 30% of the population. A rhesus D positive individuals have A antigens and the Rh factor, meaning they can safely receive blood from A+ and O+ donors. Historically, type A blood flourished when humans shifted from hunting to farming. Living in dense settlements meant more exposure to bacteria and disease. The A antigen is linked to a stronger immune response against certain infections, especially those that spread in crowded communities. But again, evolution balances gains with risks. Type A blood has a higher tendency toward clotting disorders, a slightly increased risk of certain cardiovascular diseases. Type A represents adaptation to civilization, where survival depended on resisting infection, not outrunning predators. Next is B positive, the traveler's blood type. B positive is held by about 10% of people. This type is more geographically concentrated in Asia and the Middle East than elsewhere. B rhesus D positive individuals have the B antigen and the Rh factor. They can receive blood from B+ and O+ donors. Genetically, type B is a traveler. It is believed to have emerged in ancient populations along the African-Indian trade routes, spreading through migration and intermixing. Studies show the B antigen may influence how the body handles certain bacteria. People with type B sometimes show differences in carbohydrate and fat metabolism. B-positive blood is like a genetic passport, revealing humanity's movement across continents. Another important blood type is AB rhesus D-positive, the universal receiver. AB positive is rare, carried by less than 5% of the world's population. Its red blood cells display both A and B antigens, along with the Rh factor. This means AB positive individuals can receive blood from any donor, A, B, AB, or O, positive or negative. AB is the youngest blood type, only a few thousand years old, arising when populations of type A and type B mixed. AB plus is evolution's blend, a merging of two immune strategies into one. But AB types also have higher risk for clotting and vascular disease compared to O types. Still, their ability to safely receive nearly any blood makes them the universal recipients, a rare gift when every second counts. Next is the almighty O negative, the silent protector. O rhesus D negative is carried by only 7% of people, but medically it is one of the most important blood types on Earth. Because O has no A, no B, and no Rh antigens, it can be given to anyone. It is the blood used in ambulances, emergency rooms, natural disaster trauma care, battlefield medicine. When a patient is unconscious and their blood type is unknown, O negative is the blood that saves them. But O negative individuals face specific vulnerabilities. Higher susceptibility to cholera and norovirus. Pregnancies involving Rh incompatibility require medical monitoring to prevent hemolytic disease of the newborn. Despite its challenges, O is the universal donor, the blood type that quietly saves millions. Section 7. The rare negatives. A negative, B negative, and AB negative. A negative, less than 2% of people, B negative, about 1%, AB negative. The rarest of all, at less than 0.5%, AB rhesus. D negative plasma is especially valuable. It can be used for any patient, making AB the universal plasma donor. These rare types are medically critical because their compatible donor pools are extremely small. Supplies are limited. Every donation matters. These blood types are like genetic time capsules, preserving ancient immune adaptations found only in small populations today. Section 8. Why your blood type matters. Your blood type affects who you can help, who can help you, how your immune system responds to infection, your risk for certain diseases, even how your ancestors survived history's harshest environments. Blood types are more than letters, they are evolutionary fingerprints. If you take one message from this video, let it be this: your blood type could save someone's life, and someone else's blood could save yours. Blood donation powers surgeries, cancer care, trauma response, childbirth emergencies. One unit can save up to 3 lives. It also benefits donors, quick health screening, potential reduced iron stores with regular whole blood donation, and a strong sense of purpose. How often can you donate in a month? Whole blood is typically every 56 days, about once every 2 months. Platelets can be donated more often, sometimes every 7 days, up to around 24 times a year. Plasma frequency varies by country, often every 28 days, or in some regions, twice weekly. Always follow local guidelines. Eligibility basics. Feel well. Minimum weight around 50 kilograms or 110 pounds. Adequate hemoglobin. No recent infections or antibiotics. No recent high-risk exposures. And comply with travel and medication deferrals. Age ranges vary, often 17 plus or 16 with consent. with no strict upper limit if healthy. Seniors can often donate if they meet medical criteria. Check your local blood service. Before donating, hydrate. Eat iron-rich foods. Bring ID and rest. After donating, drink fluids. Avoid heavy lifting and report any concerns. Not eligible today? You can still help. Host drives, spread awareness, or register for organ and marrow donation. Your next step? Search nearest blood donation center. Book an appointment and share your blood type if known. Your small act fuels humanity's lifeline. So if you can donate, your body can make more blood. Someone else's life cannot be replaced. Don't just watch the world, understand it, and help it. Please subscribe for more fascinating medical science explained.